I first got introduced to the idea by my medical club moderator. She asked me about the surgery, if I would be interested in doing it. I gladly accepted, and here we are today.
Okay.
Surgery went well. What we did basically was a partial meniscectomy. The meniscus is a cartilage that doesn't have a very good blood supply, so it really doesn't have the ability to heal itself. We need to help it along in one way or another. Two basic ways of doing that is to sew the meniscus together if it's repairable, or remove the torn portion. So removing the torn portion is akin to trimming a hangnail. You know, if you have a hangnail and it's kind of hanging out there, if you trim it, it doesn't hurt anymore. Mm-hmm. Unlike a nail, it doesn't grow back. So it's better to have 70% of your meniscus with no loose pieces than have all of your meniscus but it flipping all over the place and causing pain. So the surgery that we did today was to remove the torn portion of that cartilage so that it no longer got caught between the bones and hurt and cause wear and tear and eventually cause arthritis.
Okay. And tell me a little bit about some of the things that you suggested that he tweaked.
So the meniscus is somewhat like a C-shaped cartilage in the shape of a C. And basically when you do a surgery like this, what you're doing is you're kind of trimming out the inside portion of the C. So you're making it a skinnier C. We had made 2 incisions on the front of the knee, just on either side of the kneecap, and we were between the femur and the tibia bone. And where she had her tear was on the medial meniscus, which is that cartilage right there. And so we basically took that cartilage and we trimmed out, it's kind of C-shaped, well it is C-shaped, and we're trimming out the inside portion of the C, basically.
How do you think that by tweeting this, by getting information out there about what's going on, what kind of educational process is that for for students or for anybody really that's trying to find out about surgeries?
For me, I think what's good is the interaction is good because we can kind of get some information out about what's happening and what type of problems people are having, and what I would potentially like to get out of this is potentially to direct people to appropriate places where they can get information, because you can go on the internet and get any information that you want, and that's something that we as physicians deal with in the office all the time. Is people come in with reams of paper of things they printed out from the internet asking if this will work or this will work or that'll work, and to go through all that stuff and and spend time going through all these things that we know don't work, it's much easier to just direct people to a place. So I think that's where, from my standpoint, that's where the internet would be a very helpful thing. Okay.